Good luck with everyone. It is June 30th. This will be our last televised update for a while. We have Dr. Patterson and Minister Kusugak here. Minister Kusugak will go first, and he will also be interpreting for Dr. Patterson. Thanks so much.
Blakut king lapami tamona tusagak sa laganayakap nuwag juang ni umiksanut o yawningani tusayu ni aklungan luitwak sa imon. Blakut mana mo tikit tugo nuwag juang nagtakang itok suri tagwani ira nuwag juang na may sakit to kakaniraw itok Nunavut iluani mana mo tikit tugo 262 nuwag juang na kalawtut nuwag juang na kakonnektut amma 21,255 Nunavut mute kapiyaw si malaktut ataw sa klutik tapos mga nuwag juwari kutimik amma 16,284 ni amisuti giyut tamay ni kapiyaw si malaktut nuwag juwari kutinik Nunavut mute taktigut ikaw mayari akaktigut taman na nuwag juwang may ulogaya sung udyo sung naglu isulingin masuli takwa kasubadliarak takalawut maliktaw yakali nuwag juwa nagtakakuyingin nagmo kisiya ni tamapta naalagi akak tugugalo aksuli tamakkuninga sakkitaw baldia yunik udyak tukutaw yakay akak tuniglu nuwag juwa tayo mani umiksano tamapta lukta ilaw yakay akakapta nunari kutigiyabut takwa ang ikakayabutlu nuwag juwa nagtakalakunagi awyawningani taguna sakayalo ta okaldawik sa kanijang itugu tamatuman nuwag juang ni umiksanut kisiya ni tamakwa tusagaksay naniyaw yun nakto kakitaw yatigut nalaw tikok to kakatang ni aksuni amma asing itigut tamana tusakuti o katak tutigut amma takwa atok lugit tusagaksak takaw yakatang ni akok tusagaksak takalirangan nuwag juang ikutaw nuwag juang ni udumiksanut tusaw matitini ako gudu tamakwa asidyak to kadang nakpata sigulak tigiyabu sabi kita o kasung matuak si mayakaya kaktugut agabayang may katalo tigut amma kagdiluak tayo lilota ino katiptinut amma inugiyak siluak tayo lakatalota inugiyak tunik tayo lakatalota do kapiyaw kanak si mangik kubit kapiyaw yak to kaya kabit tamakwa kaputit nuwag juwari kutimut piunak pangong mata nuwag juang nagtakta di manang mo. Ujyak tu tiyakta, kaway sa tiyakta, ino katigi tiyakta ro awyaw ni ngani ila tawong aluktanong galo. Good morning. There remains no cases of COVID-19 in Nunavut. There have been 262 recoveries since this outbreak began. So far, 21,255 people in Nunavut have received at least one dose of COVID-19 vaccine, and another 16,284 have had both doses. It's important for all Nunavut mute to remember that this outbreak is not over. As we gradually ease restrictions, it's critical that everyone stays vigilant and follows the public health measures. Everyone has a role to play in keeping our communities healthy. Now that summer is here, we don't have any further televised updates scheduled. As always, information can be found online, on radio, and on social media. We continue to provide regular updates on those platforms. If anything changes, we will keep everyone up to date. As Premier Savikitak always says, mask up, wash your hands often, keep strict physical distance, keep your bubble small, get vaccinated if you haven't already. The COVID-19 vaccines are truly the best defense we have against this virus. Please be responsible and take good care. Do the right thing for yourself, your family, and everyone around you, and stay safe. Doctor?
Thank you. Good morning. After more than a week without an active case of COVID-19 in Iqaluit, it is safe to ease restrictions in Iqaluit. Effective July 2nd, in-territory travel restrictions for Iqaluit will be lifted. Isolation for those leaving Iqaluit to another community will no longer be required. Indoor and outdoor gathering limits will be increased, and full details on the new public health measures can be found at the Government of Nunavut's website at gov.nu.ca.
Blakut Pinasuako si Lukta, nutamik sakit to kalaong itok suli nubagduang nakaktumi kalong ni. Tayo man na itidlugo, maana kasuyaw yaw naksiyo tamakwa pitay liniyo kalong ni. Pigiyak lugo July 2 Nunavut Iluani, ingi kayak tut kalong ni sila tanot Nunavut Iluani, takwa pitay li jutingin pirtaw si malaktut. Tayo ko kitumiat kalong ni out laktut Nunavut Iluanut maana inutu kubing moare akang imelaktut kalong ni nga kalawautik. Igdordua Iluani sila miluni katekattaktut inu isang ningit kasuyaw yang niaktut amiso naksawleron na kulugi katiyun naktut. Takwa ilulingit maligay miksanut takuyaw yakan na naktu government kut ikiak kerotani taikani government.nu.ca.
Well, the case count is 0. The outbreak is not yet over, and I encourage everyone to follow the current public health measures. There has been a decline in the number of people being swabbed in the city. Fewer cases and increasing vaccination numbers has contributed to feeling that testing and screening for COVID is not necessary. I encourage people to continue to get swabbed when contacted by Iqaluit Public Health or whenever there has been a chance of exposure to COVID-19. Identifying the virus early is the best way to contain it before there is widespread transmission. We would like to continue screening individuals who are in groups that are more likely to have been exposed to COVID-19 or are more likely to spread it to larger numbers of people. This includes the following: rotational workers who are regularly in the South, staff or residents of congregate living settings, and individuals who work with the general public, such as cashiers and receptionists.
Tako nubagduang nakaktut maana mo tikitlugo pitakang ilagalwak titugit naman na siya magpaldianak suli kayo siyun nangman isulingin masuli. Tayo man na itidlugo, tapos maliko galawak pagka Inuit, maligak sa unit nubagdua kay kutiyumik sanot. Udyang naksunilu, tayo ko akaway saktaw kataktut nubagdua nakangikalo ang mga ata, akaway saktaw na kayang Inuit sa klibaldia si magmata ang iyumik. Amisungin naksait, Inuit, isumakang mata, kaway giyak taw katang ime ako mablutik. Amisuin na palia tidlugi tamagko nubagdua nakaktut. Isiyani, Tilio bunga inungnik kawayigiak tao katarit anya wipsinut nubagduang nakangikalo ang mga akpit itokringin lang nerobit ang takwa kalong ni o kumay naksiyok tao vikut kawayigiak bigiyun nakpasi tamatuminga tukisigiak lutit nubagduang niyo miksanot kagliloak takalawang ikalawang ng mga akpit. Kaway sali yun nakangap ta nubagduang nakaktuwin nakmik taman na siya mangipala ko timakayalo kataman nubagduang namin. Kisiya ni kaway sa'y na kumabugot tamak ko nga inugiyak tunay kataktunik nakwa nubagduang namin aktua si mangikalo ang mga ata. Tayo man na itidligo inugiyak tunay kataktut siya may kala naksaw yun ng mata tamak ko nga nubagduang namin. Uktu tigilugo tayo kwa sanayak to kataktut kabunano ng anit tamang ano na bumut kaway saktaw katayak ang ningit. Ama tamak ko iglumiyo katakaktut amisunik kakayaling ni amisunik lu iglumiyo katigiyakaktut ang matay ko pilariyot tamak ko nga inugiyak to niya katakto ni solo niuverving ni katibving ni doan niya ni do tamak ko na ni.
The Pfizer vaccine has now arrived in all communities, and by the end of next week, every Nunavummiut who is 12 or older will have had the chance to receive their first dose. Anyone who's missed initial Pfizer clinics can call their local health center for an appointment. Experience in several countries has shown that widespread vaccination dramatically reduces the harm from COVID-19 infections. By late July, almost 3/4 of Nunavummiut will have had the opportunity to receive 2 doses of vaccines, and we will be able to further ease public health measures. I ask everyone to continue to follow current public health measures as this protects all of us. Thank you.
taman kaput Pfizer mi tai yokta baktok tamakunungan atokta yun naksisima yun nutakkanut 17 ni pob ni ukyo kaktuno tamani akon ningani nunaling nutamay nunabu iluani tikisimalakto amma pinaswa ako sa kanyaktabut isulipat ipaksago tamang miluktano na bumiut tuwab ni Iqaluit ungatano do kapiyaw yun naksisima niyakto sibul lakpami kapumik tay kuwa kitumia kapuktaw Iqaluit Pfizer mut ang ngutilawngin nakpata anyawip sinukaw igiyakat si kaku kapiyaw yun nang niyang mga apsi tapsi mga kapumur kawai si mayugut silak juang mi tao katibut tamo tuminga kapuktaw balia tidugit ulukaya nangin naksamakaya lore katang mat COVID takayang nagmi kapiyaw si malagluni July nungulak pa July isok pa siya ni nunabumiyo tamang mikasak na pangataong at ikadlanot kapiyaw si mayun naksiniaktut makwirlutik amma kapiyaw si mayun naksiyo amisunak saurak pata tamakkuwa maliktaw ya kaya di kasutik palya yun naksitsiyang na yakap tigo nunabum iluan apiribugu kituluktani malako iblo tatama tuminga anyak tayo liman yung miksano sak kasi may nirayap tinik taman na uwap tinik may naksityo tauman.
Kent Driscoll, APTN National News. Dr. Patterson, this is one you've covered before, but I have been receiving it recently. Considering there are 0 cases territory-wide, and it's been that way for a little bit now, why do we still have a public mask mandate in place?
Kuyan na may tamna ito aksay ukaw sa kasi malaktakataw sa ingit lugo kaway malaksutalo man nubagduang nagtakaktukang nilakalo aktil lugo nunabu iluani so matuak si maya kaya kakpitasuli.
We're still at risk of introduction. There's still and that's in some ways increasing as we allow more people to travel or as more people travel. And when we look at other jurisdictions like Israel that have said we're vaccinated, there's not much COVID, we're going to lift the mask mandates. They've had to put those back in place because they've seen rapid increases in the number of cases.
Kawai ma yugo taman na nubagduang siya magkanderon ng nakayang ano na builuan tamakwa kasutik tawa lerak tilugi ingi kaya gunak tu nuna bumit sila tanut ama sila tani nuna bumut taman na ingi kayo nang niya nubagduang niyo amatok siya naksaw si marangmat tamatuminga ulo kaya sutik kaktugut kawai mablutalo nuna li solo Israel mi ikpaksan ni sak kapiyaw si mayo mi sunak sawlak tilugit nubagduang nagtakaon nirak tilugulo tamakwa matuak si maya kaya kaun nek titaw laong mata matuak si maya kaya kaun nek titaw tuang mata ami sungok palya si kau tigilak si mang mata tamakwa nuwag duang nekaktut tayo man na itilugo man na ulugan ang ningaman ni matuak si matitsiyugon.
Dr. Patterson, the way the rules are now, in order to bypass the medical travel hub, you need to show proof of having both your vaccinations for COVID-19. When you were discussing this previously, you said the department would be investigating a number of those people to see if their claim is true. What percentage of people who say they have been vaccinated both times are being investigated by the health department to make sure they're telling the truth?
Ito say taman na ukaw si baldelak tilugot taman ni kapiyaw si mayut awdlakon nakatang niyang nakayangin nabu sila tanot inutukubing migi akang idlutik o kalaw si magawin tay ko kaway sakta katang niyang mata suligalo ang mga ta kapiyaw si managayaming ni kapiyaw si madlatalo ang mga ta tamaking ni kapsi kaway sakta si malakpat takwa suligalo ang mga ta.
Right now, it's the vast majority because the vast majority of applicants for that are Nunavut, and we can check in Meditech. For non-residents, I can't remember the exact number that are being picked for random random verification. I think it's around 5 or 10%.
Mana tamang milukta kasak taiban na kawai saktaw yun. Nunavut miuta luktali, Nunavut miuta kawai saktaw na takawon ng mata tagbu na kakitaw yatigu kapiyaw sa manakayang itamik sa anot maritak maliklugo. Kay kuali Nunavut miuta ang ito tamatumu na kawai saktaw yun imaka 5 or 10% solo 100 muna yakpata uktut imaka 5 kulilun ni kawai saktaw na yaktut suligalo ang mga ata.
Jordan CBC kuni aperiwa tuguli dakwa 14 ni nukanga titaw yaga ku pititaw yaga kang ni mak mata kapiyaw himayu ukyo ataw herotam na atuin naw yulak ma angit taw himajuti nukanga yaga kang ni mak mata 14 ni ubluni ta na pijuti kappa kapiyaw jutaw na yak tumi pingayu giyangani the isolation exemption is good for a year. What is the thinking behind only having this for a year? Does it have anything to do with us needing a booster shot?
No, it has to do with it just being long enough to, more than long enough to get us to the point where we're not restricting travel and not requiring that kind of a letter.
Akachemari takwa akuni unaraya nga namana ka sa tuwing naktok tamakuni nga titit kanik atuin naktaka ila titit kanik tuksiray na kaya kangin na kaya tinik amma kaya ko nga akuni unarsak tamakuni nga pila kaya kaya nginip tinik.
And just to be clear, no one's thinking that it's going to be another year. It's just that will take us well past the point where those kind of restrictions are in place.
Isimayo kang ito ukiulukta mo tayman na itunik atuin naktakaya kang na ingi kaya gumaluni kasi ni tayo nga ato kaya kang narayap ta ungatano taman na nalapta simayo.
Takuali nahak taw himaba kitu ila kabluna nunangit nung ngak himayu 14 ni ubluni nok kangagwang itu titik kami apere himayu. Is the number of people that have asked for an exemption, do you have a number for that?
I don't, at least I don't think I do. No, I don't, but we can find out later.
Aka nasa uta kang ito kasi ni kawigi akon lang niyaktago.
I'm a Tranter Canadian Press. How many people are in isolation in Iqaluit right now?
Tam na Tranter Canadian Press kuning ngakto kapsiman na anit tayo liyaw Iqalungni.
None.
Nan pita kang ito.
Can you clarify the rules around women who are sent south to give birth? Are they required to complete isolation in one of the hubs with their newborn?
Ukahon nakpi taman na nutakaktayak tok si mayo kabdunano nangan ni nutakta si malakti luit inutukubing mitaka kakpakabdunano nangan ni nunabumuutilaw tinagi.
In most cases, yes.
Just to follow up, would they qualify for the expedited medical travel in that case?
Takwa taman na itidlugu akik taw yun na kayang ilaka taw na ni kutagi akangin narmig tuwagang naktukuli ilangin taw na ni kutagi akangin jutini angyak taw si makatakto maliklugit.
No, the expedited medical travel is generally for short appointments where people are going down, getting, 1 or 2 assessments or procedures done, and then coming back. In the case of women going south for delivery, they're often there for 4 weeks or longer, so isolation is still required.
Taman nali taw nung ngakatakto utikaw tigayon nakatakto. Ito sa imi takwal la tuwid na kaya kasuong mata ataw sa klutik makwal klutik lunit Takuna ni tuyong mi ila inutu kubing mingin nak tuti yun na suong mata taiman na mudli utikaw tigi yun nak tu tamakuli nuta tayak tok tu ilani sana tayo nu sita manut ako niyo nagsarlo ni tao na ni tayak kakatang mata taiman na itukong ni ayok tu.
Dustin Patterson, that's it news. Do you have a timeline on when broader reopening plans are going to be announced?
Sorry?
A broader timeline, or a timeline on when broader reopening plans are going to be announced?
Nuna tiyarnos mingak tu pero yung kakuli kasusiman naksakan nang tu sagak takaon nang niyang mga naroon at si mangilasi.
No, I don't. We were, I was hoping we'd have them ready earlier, but we're still working on it.
Man pitakang ito atuin nakukumalok takaluawot kilam yun nagsakisiya ni man na pilariya usulit naman ko.
You had previously said that your biggest concern was unknown spread in the community. There's now no one in isolation. We've had no new cases for over 2 weeks. What's your biggest concern now?
O kakatak si magawit uluragin at pare nakaklugo siya magpadlian na kaya nga taman na nuwag juang Nunavut ila nunaliw iluan kaway mayawang ilun sunaw baliman isumalo tigin at pare ay tapos masila tawag.
Well, there's still the concern that there's hidden transmission from the leftover from a couple of weeks ago. There's also that steady ongoing risk of introduction of COVID-19.
Taman na suli siya magpalya yun ng kaway yung idlo ni ikpaksaan ni taman tamang alawak tidlo kaway mangitap din siya magpalya yung kaunang niya sulitam na isumaraw tigiyabot amma isumarong naktok sulitaman na tikitaw kandirun ng nitininuwag juang namin.
Trevor Wright, Nunavut News. Could you remind us what the vaccination threshold for the territory is and how optimistic you are on reaching it?
Trevor Wright, apiri yuli sunawana sa utikin na suktasi kapiyaw si mayun na to amisunak ila amisunak pango yun nakuluit ang makakutan na tikitun nakasugibis yun nasaw.
There's not really a set threshold for anything. It's just we want to get as many people as possible vaccinated and ensure that everybody has the opportunity to protect themselves from COVID-19.
Nasa uti takang itok, uwang atikit tumayaw, dugo si mayok takang itok, kisiya ni Nunavut mute, tamang milukta kapiyaw yung mayut, kapiyaw yung naktin na suktabut, kapiyaw yung naksitlatwak patak si mayugot, takwa kapiyaw yung nakto amisunak sa kugarwak lutigot.
Is there anything being done on regarding lower uptake in a few of the communities? I counted about 5 communities that are between 38 and 33% as of June 28th.
Kanwili yung nagtakang niyak palita ko nung ano nalingnut amisung iluak to ni kapiyaw si mayok takak tunut imakatad limang matanun nalit 33 to 38% kanigayani kapiyaw si maningin narunak si mayo June 28 mong tikitlugo tay ko le kanwili yung nagtakang niyak pa.
Yeah, there's been a number of efforts. The health center staff in many of those communities have gone on the radio or made direct calls to people, and we're working with NTI's support in the community clinics in some of those communities, and continuing to encourage all Nunavut to get vaccinated as soon as they're able to.
Tap ko pilay katigi yabut anyawing mi pilay yut na yang wadlo asing idlo nalaw tikok paksutik kapiyaw yun nakto ni kapiyaw yung mayon naglo apeksok kapiyaw yun nalagayang mga ta ilang idlo o kalugyot siya makikpagtuti kapiyaw yung mga ta pilay katiging mi yabut Nunavut mitong ngabikot rako kapoy nang mod ikayok tuy ningit malikluti pilay katigit siya kasok tabot amatunga amma Nunavut mi utamang mi o kaujoy naktabot kapiyaw yun na COVID ati kapiyaw yak to.
Ken Driscoll, APTN National News. Dr. Patterson, most jurisdictions in the country allow people to isolate at home when isolation is required. I'm wondering specifically about here in Nunavut, where you have to isolate if you don't have your vaccine. Has your department put any thought into letting families with someone 12 or under who can't get a vaccine do their isolation here in Nunavut as opposed to Ottawa? And if not, when do you expect that sort of change to become practical?
Kawimagapta Canada mi amisut inutu kuving wa rea kakatang imata ay simaluti inutu teto patas simanang mi pitakarang mata inutu kuving nunga katang ituti kisian inunabummi tayaman nangimman inutu kuving mi tarea kamata tamaw nga nunabumwaraw kaktin nagit kanokli isa magsaksok si mangila si takwa tuwab ni ukiuli tunganudlo inutu kuving mi tareali nunabumwarangata Tagbani ang ikakayamin ni inutu kuving mitun na kayang imangata ang ikakasimalutik ang arawaming idlutik. Kakugulita man na isa magsaksyak si Mannerop si Pilirarayaw na yakpa.
Thanks. Just to be clear, there's people isolating not just in Ottawa, but in Winnipeg and Edmonton and some even in Yellowknife as well. The current plan is that once 12 and up have had a chance to get fully vaccinated, then it would be safe to move towards, or it would be safe to allow isolation at home if isolation is still required. So we're looking at late July, early August, making that switch.
Tukisinak siya lugo arawami naong ito inutu kuving mi katang mata taikan ito Edmonton mi Winnipeg mi Yellowknife mi lu inutu kuving mi gaya kakatang mata tamang nga raong inni kisiya ni tamag ko tov ni upiuli tamang mi kapiyaw yun naktu kapiyaw si marak pata kapiyaw yung mayon nila amma ulogaya na luaon nekpad tamag ko kapiyaw yun nang ito tov ukiuli tunga nilo Tagbani ang ikakasimaluti igluwini inutu kuving wakon na kayang nangin ni man na kimiko yugot tayo man na tuminaktok isamaliakaya buman na imaka July nung uklani August ato kaya risapad luni tamani palo nunavumiyot ang ikakasimaluti iglumini anitayli yung na kayang nangin ni.
Dr. Patterson, I just want to go back to my previous question about investigating if people actually have their vaccines. Among the Nunavut mute or the 5 to 10% of non-Nunavut mute who you're investigating, have any of them been discovered to have been lying about getting their vaccine?
Tana utarbigigya ako mablugo kawi sa katang nakakagap si takuning ay maka 5 to 10% kanigiyani Nunavut ngauna suktunig kapiyaw si maneraktunig kawigya katak si manerakap si suligalo ang mga ta kapiyaw si manerayang inik Sagduna sukto kaksi mayunik kaway si Mangila si.
No, aga.
Akit siya maki.
Unat ka maligya ako ti inuning nga to takwa ihumakakaw kimalik pihi kano nutaka 12 atani ukiuli piyagtaw na mga ta ano no kangat sitaw nang mi 14 ni ublo ni ugtu tigilo no takalapta ha anana ubiyaw yulo ni no takalapta pata no kangat sitaw yaga kang na pa the question I have is from the followers on Facebook asking, have you considered removing the isolation for parents that have been fully vaccinated? For example, if a mother got a newborn, would they still need to isolate?
Yes, they still need to isolate in the south at this point.
Inutu kuving mitara kaktu na nutak kesaan ikut mana mutikitu.
Do you know when that might change?
Oh,
Kanagu dam na jawab tahu pa.
right now, the earliest we're predicting for changes in the isolation is late August, or late July, early August.
Man kami kuni aktu asiji palian na yang ini tamak ko ino tu kubing itu imaka July nung wani August atau eri sak palune.
Emma Trancher, Canadian Press. Last time we had one of these updates, I believe there was still somebody in the hospital. Can you give us an update on if anyone is still currently hospitalized with COVID-19?
Ikpaksani tayo man na apak song nagtakakatak tiluan ni awing mito karaw manuwag doon nagtakaktumi ublumimut ang mutitigi ako nakpitigut kanwiturang mga taman na.
There's definitely nobody in Iqaluit with COVID-19 here in QGH. And it's been over a week since I received an update either way on the individual in Ottawa. So I honestly don't know, sorry.
Man na ukaw naktunga ikalong ni ikaloy ane awig juang ni nuwag juang mo ane awig may tok takang itok ama pinaso ako si ungata ni tusak si mangilok tugut araw ami ane awig may tok ang mga ano na bumiutak mi nuwag juang takak tumut man nakaway mang itugut tusa mayakang itugut.
As of Friday, bars can open in Iqaluit. We know that bars in town were sites where COVID-19 was transmitted. What are you doing to ensure that does not happen again?
Tadli miulak patamak ko imigalag bi ikalog ni ukwi kan neon na siniyang mata kaway mablutalutai kan imigalag bing ni taman na siya magpadliaraw si mangman nuwag juang na kano ilong ni akpisi taman na taman na itukukan na kunago.
So there's a number of things that we're doing to reduce the risk of it happening again. The occupancy limits are opening up small and will stay small for at least a week. And limiting some of the higher risk activities. There's no karaoke or dancing. And at least for now, staff, individuals who are working at the bars will be required to wear masks so that there's limited transmission between tables.
Siyama ko nagu man inuisak tuin ni tayo kanito kakunaktok inugiyak si tayo liniaktut imakapin na so ako siluktak siyama kan ako nagu tako imigalagbi imingyak tunik pitakakon na diyang itok mumeron na dyan na tiglo tayo kani piyagiyaw wagtut imigalagbing ni matuak si mayakakang niaktut siya magpadli ako nagu tayo kanito.
Justin Patterson, Tech News. Across the world, the Delta variant is accounting for more and more cases. What risk does it pose?
Sila juang mi kawin nakpadli ang mataman na nuwag juang narunay kutsak tao si mayu Delta mi sanginia ingi ka siya magpadli ang making masilak juang mi kanokli taman na aktuwa si maba Nunavut.
It poses some risk, but that risk is still relatively small. The vaccine still works very well against the Delta variant, and public health measures like masks and maintaining distancing and all those other measures and steps that everyone can take and has taken to protect themselves, they all work against the Delta variant. So it's a manageable risk.
Taman na ulugan ang nagtakaktuak to yun ng narayang Nunavut mo kasi ni Mikiyok taman na ulugan ang narayang taman na kaput tapos mo nga Delta mo ayong imat nukaktitsiyod naksunilo matuak si managlo kagliluak tayo managlo ino kating nita magkuatok tao tinaktaw tamatungat tao siya mangipala ko tiyo niya nalo nang ito ni ulugan ang tumaktitsivali katang ito tamakkuwa man na atok tabo atok lugi.
Next question is for Mr. Kusugak. Do you have an update on when the elders are going to be returning home?
Tan apere uvamni, you want to translate for me on this? Kaku ino toka si ving mitu ekalong ni uteron nang niya patagunga ino toka si ving mo ekalong ni. Man nakaw yung mga itugu ublong mi teman na ito ng mga ta ukaon tu kasi ni taman na kayo si Badlia yung pilirayang na kaya nga ang iyukad ang inaksawsuong matayla ni pilirayang yung magpektok tao laga ang ata akit tao yakang na kaya ngit mingwak tao Badlia ni nga kayo si Badlia tiyaktok igalang iukuang idlu nutangok tao Badlia yun igangalo nating idlu akit tao Badlia yun amma takwa kayo si Badlia galwak tidlugit taikwa tapos mga aulat sinayaktut mana okakatigi yabusuli tama nga kemaggoyak tong niya law ang mata tapos mamiksano kanu itu mga tautua okakatigi yaw tiarlo tiglo aulat sini mamiksano nubagdoang ng pidyo tigiblugo utak kayo malilaw mata tayo naro na itiyatwak pat itwak sa iyo juwaga yabot ikalog ni ulokayan ako nertok tayo ko tikitun nak siniyama tama ko katiluk taklo pianik patakisiyan ni tikit uteron na nertuin na Thank you for the question. The same response that I gave before hold true now. Like any renovation project, when you go into it, you start peeling back some of the repairs that have to be done. You find that there's more work that needs to be done than initially found. So we're going through that process. The contractors are still there. They are replacing doors and windows and other necessary work. They are repairing the kitchen. They're putting a fresh coat of paint and repairs into the walls and some rooms. So once that is all complete, plus the current contractor that we are interested in taking over the site have not had an opportunity to visit and take a look at the establishment and have in-person meetings about it. That plan was supposed to happen previously, like a couple weeks ago, but because of COVID, they did not want to travel here and have to go through the isolation process. So as soon as they are able to do that, once we go through this phase, then all those will come into place. So I'm still very hopeful that it'll happen sooner than later. But it will happen when it is safe for this to do so.
Trevor Wright, Nunavut News. Question for Dr. Patterson. You mentioned the decline in people being swabbed. Is it because testing is winding down or more people refusing swabs?
Ukakawabit takwa kaisaktaw katakto nubagyo na kangikaro ang mga ta amisuyon ni padang naraklugit sunapidyo tawa.
Well, testing isn't winding down. There's still staff at the cadet hall, and the bus, the mobile clinic is still working same as before, but there's less interest, or it seems like there's less interest in people getting tested just for screening, randomly tested. And so we're encouraging people, if there's any doubt in their minds or if they're in one of those groups, to come on in and get tested. If you have any symptoms that are consistent with COVID or could be consistent with COVID, please don't say to yourself it's probably just a cold and there's no need to get tested. We'd much rather test dozens of people than miss one infection and let it spread.
Pilirigin nagsawala aktaw ngitiaktok mana mo tikitugutay ka ni kawisaktaw takaktok suli kadat kami kawisaktaw suli aman ingagayaktok takaktok na siutimik kawisak padliay yok kawisaktaw yung mayunik kasi ani amisungin nagsawala matatamak ko kawisaktaw yung managtakaktut kasi ani tidiyungin nakarok po Inuit kawisaktaw yung nakupsi kawisaktaw giagatsi atwin na tiaktugut ang makinamiak tapos yung COVID mixanod nalunay kuta ni COVID takalingi karo ang mga ta kakilinaklo tamakkuningalo kay atoktut kaway sakto yakto kitsi isa mangidlo si nuwatwin nakto nga kaway sakto ngimyak na kamangidlo si kaway sakto kitsi nuwatwin nakto tirtaw na mikinak sa makayong maitong na saudo nilo kaway sakto ngin kaway yung yadlang ng migdo kaway sakto yung nakupsi uluanak tumiko silo kawai saktaw yaksak isimalong ido sa kawai saktaw yak tokataritse.
At the current pace, so when are the outbreaks here in Baffinland going to be declared over?
Kakuna lunar simaniakpa taman na nuwagjuang ni uluanak tumito ni tiyang ni akto ikalumni.
Iqaluit's outbreak would be 3 weeks from yesterday, 4 weeks from when the last case is recovered.
Ikalumni pinasawa si pingasut anigok pati ikpagsangmit kanu ito kakaningipat tayo na kingunlak pa may kaway yolok to pigyak bilugu isulipat sa natay no si tamaniyo na yaman.
For Baffinland, there's still one case in mid-June that there's some uncertainty in whether or not this case is a direct link with the transmission on site versus getting infected in the south. Once we can sort that out, we'll be able to figure out when the outbreak is officially over, when the Baffinland outbreak is officially over, but there's been no cases on site for more than 3 weeks now.
Taikanili nuluyani taiko lalo na ko yung masuli June kita pasiani tayo na nuwagjuang nakalaoktok taikang nga nuwagjuang naktalaw mga nuluyanit ubaluba kablanano nanganing nga o jawlaw ni kalawang mga tayo man na itidluguman na kaway na suktugut kan tamatuwa miksanot tuki sinaksitsyak pat lalo na sitsyak ayak tugut kakugutaman na nuwagjuang na isulitun niraklugo kakun na kayang mga tayo kaninuluyani kasi ani maka tagbani pinasawa si ni pingasuni sita maniglon ni atong ni akta tininalo na tiyang ni akta taman na nuluyamik sa ano.
Ken Driscoll, EPTN National News. To continue with the mines, Dr. Patterson. In previous press conferences, you said you had been working with the mines, with Agnico Eagle, about trying to get Inuit Nunavut back to work at those mines. How's that going?
Taman na uyak akta remik sa kayo siyun na wakta o kakatak si magawit Dr. Patterson take ko Agnico Eagle ko pilari yung Inuit utak palya yun naktituman nakakluit sa nabing mino kano ilak pa taman na.
Nunavut have been going back to work for Agnico Eagle for more than a week now, and they're bringing them back in a phased-in response, or in a phased-in approach, bringing a few back at a time, retraining them, and getting them back to work. For other mines, it'll take a little bit longer to make that happen.
Taman na pinasaw si ungatano pilari ang toktay ka ni Agnico Eagle kut pilari yung utak palya ang uyalaktut sukay tumiyo galwak ataw tiko along itok tay ko sanayak toktut tay kung utak lutik pilari agilak tami miksanot ilinyak titaw kan naklutik kanu ilayo katang na kayang ita miksanot tay man na itilugo pirok palya ang uyak tutay ka ni amisuning pilari bing min utak palya yun Agnico Eagle mut kasi ni tay ko asing uyak aktariyat ako na yung naksakan niya dito, pilari ang niya dito.
Una, ang ayaw kami, apekoti, nutarariyaw yo, take 6 ni 12 ngong nelak pa, kapiyaw yu luak pa. Question from a parent, if a child is going to be 12 within 6 months, can they get vaccinated?
No, they have to be on or after their 12th birthday to get vaccinated.
Ak 12 ni ukioktak pakisiani, taika ni ukioktak naldiuti niya nalakpat uvalo ni ungatani, tungani yung ito.
Unali, ilig no ko apeko tao na yato, kawi mabihili kya kano, awla tao ni kawi alak ma tam na awla ta lek sutik lo kablo na no nangit no Inuit Nunavut minga tu kata ko ikayu tigiyaw tak tu Canadian North kut no kayu hina pahuli ukaw herit tak pihiulo ni since more people are traveling down south, do you know how much longer you'll be subsidizing the Canadian North?
Taikua pila katigi yaung inaktu takun nga kino elgai kun amagawa makutinut. Taikua ting misu ni aulat chiyu yut kino yaktong nira yang ita miksanut. Nang minak aulaun nak situak pata Iqaluit isulin na yang mata kisian ita man nakayu sa kataktu ubdutama kasa okakatigi yaung inaktu tamatuma kanu Iqaluit ita miksanut kayu sini ang nira yang ining. That conversation continues with the airline and the appropriate departments and with finance to deal with when those support will end. That continues on a daily or weekly basis to ensure that they only get support for as long as they need it.
I'm a transfer Canadian Press. Can you give us an idea of what the vaccine uptake has been like for people ages 12 to 17 across the territory? Has it been high in the beginning? Just some insight into that.
Unipkara digunang ilata kanu simalang mga takwa kapiyaw kataktut kapiyaw yung mayudlo 12 mi 17 no Iqaluit kogvasik pa kachok pa liya ba sulaka ba.
It's been really good. The first 7 days of that Pfizer was available, about 1 in 4 of Nunavut in their range between 12 and 17 got their first dose.
Piu yung mga si mayo takoy si mayap tinik amisun sitama nayak pata nukapiat tayo man no Iqaluit kapiyaw yung naktuni ataw si kapiyaw yak to katak si mayo takoy si mabutigo
For fully vaccinated non-residents of Nunavut who are entering the territory, can you remind us what rules they have to follow? Do they follow the same public health measures as the rest of us, or do they have anything additional they need to do? I'm thinking wearing masks outside, as we did at one point.
Tiki palia yun Nunavut ungitut. Sunanik limaligya kakpat malikto yaya kaktumana sila tagut. So luan sila midlutik matuak si mayaya kakpat tamang ngakangata. Kapiyaw si manik tumakuwek lutik kablunano nangan ni tiki palia yun Nunavut ungitut.
No, their the public health measures and rules for them are the same as they are for everybody else who's been fully vaccinated.
Katay ko maligya kaktangit adjituin na siyang Nunavut maliktaw yaya kaktu kapiyaw si manik tu numakuwek adjituin na siyang na yaktangit.
Justin Petard, Nunavut News. If all goes well, when can Iqaluit residents expect to see things further reopened?
Sunaluk tayong ikatyak pat Iqaluit tayo kaku kasu si makkad na tunita ko yun nang yak.
At least a week.
Pinaswa ko si kanila pakay.
Obviously the outbreak is ongoing, but what have been the biggest takeaways that you've learned over the last two and a half months?
Taman na kayo si Iqaluit tilugi siya magpalya na kaya nga isuli si mga Iqaluit tilugo. Tagwan itakim ako nga tikan niya no lusunan ni tigo si yun nakpi ili si mayang ni tamatuamik sa ano.
I think there's been lots of learnings, and we find with each outbreak we refine our approach. But it's not just me, there's a whole team of people, and so when a little bit further along, when things are less busy for those staff, we have a process to capture all of those lessons learned and produce an outbreak report, and then we can use that to modify our approach. Probably the biggest single thing is the change in spread for people who are vaccinated. We did see some breakthrough infections in people who are fully vaccinated, but they were almost all in people who had household exposures where they were living with COVID for many days, and so they did get infected, but they were all either asymptomatic or only very slightly symptomatic? Sorry, Minister.
Taikwa ilisima yabu imaka tagwani siwudlami ubangatwa tamatuminga kamangin nama miksano amisumaka yung matatagwani nuwagjuan tayo mani miksano pilariyo pilari katigiyaka imaka katsokjomik pat pilari ari yabut uimanalo ako nekpadlu narunang itong iksiba katigig ni aktu kemergulu tigudlu tamakwa sunani ilit simabita sunani taku simabita nauko akiya on nakpita tayaman na ito mi katiman kakumak tigut sakit chilo talu iman na tayaman na ito kurang migupta iman na iliw kan ngari akaktigok simayunik narunar simayunik kasi ani maka angin pa ilit simaya katagwani siyam magpaldiyan na kaya nga asidjitsiyalaw kapiyaw simayo amisungok paldiyan ng imaliklugit kapiyaw yun amisu nagpaldiyan at tilugit taman na siya magpaldiyan na kaya nga asidjak simangmat ang kawibalak tuta taman na kapiyaw simayo iglumiyaw katakak tilugit tamat mi nga nuwag juang nakaktumig kano aktuktaw si manakang mga tako kapiyaw simayo anyang ng mod ang makano ikping nang na kaya nga asidjak simang mga tamakwa kapiyaw si mayut iglumiyo katakaktilugi kapiyaw si mangituni tamakwa tagwa ilipalya si mayabaw manaro nang ito kayo si balyan akto. Tema? Thank you.